Hi Surat, I am happy to introduce the man himself who is a pioneer in lipedema, not only in India but also in South Asia. He flew all the way from Hyderabad to Surat in Gujarat to spread awareness about lipedema. Surat welcomes Dr. V.K. Srinagesh at Omega Hospital.
Hi Ekta, thank you very much for this kind and overwhelming introduction of myself. I am just a plastic surgeon who had training in Germany about this condition called lipedema, and I have been working on this particular lipedema along with my regular plastic surgical practice at Hyderabad. And thanks to the people of Surat who have actually given me an opportunity to come to Surat to educate people and help create an awareness about this condition called lipedema, which affects nearly 10 to 20% of women across the globe.
So, you being in Hyderabad and the patient being in Surat, we would really like to know how the patient approached.
Actually, the patient is basically from Surat but lives in USA, and her husband has done a lot of research on this particular subject called lipedema. Found out, suspected that his wife has lipedema, and then contacted me through my website. So www.lipedema.in is my website. She went into that, found out, and then contacted me at Hyderabad. And because there was a very short time during which she was coming to Surat and going back, they requested me if I could come over to Surat and do the surgery for her. This is the first time I have stepped out of Hyderabad to do a lipedema surgery, and thanks to the people of Surat and the Omega Hospital, who have been kind enough to give me the facility to make it happen.
So, was the diagnosis done online?
Yeah, this diagnosis was initial diagnosis was made online, and of course the full detailed history was taken. We have a lipedema evaluation proforma which they fill up. They send us the relevant pictures. We tell them how to take the pictures, and they do take the pictures in the same format and send it to us, and then we have an interaction, a one-to-one interaction. So we reconfirm all the findings, and if something has been missed out, or they want to tell us something, and then we come to a decision. And the final examination, physical examination, is done before the surgery, 1 or 2 days before the surgery, and then afterwards we finalize the plan of action and then go ahead with the procedure.
What was the suggestion and the treatment that you have suggested to the patient?
See, as with most of the people, we are not sure whether they really have tried anything or not. So we tell them to go on an anti-inflammatory diet, do certain exercises, try out regular weight loss measures. Second is, we ask them to go in for manual lymphatic drainage, use a lymphatic pump, or do lymphatic massages.
Okay.
And many of these patients, surprisingly, would have already tried all these things, and then they have come to a conclusion. Most of the patients make a self-diagnosis of lipedema before they approach me. They have already decided that surgery is the best solution for them after having done enough research. So for those people who have not done the research, first give them a trial of conservative measures, as I have mentioned. Then if that fails, then only we tell them to go for surgery.
Okay. Has this patient tried any treatment before they consulted you?
Yes, this patient has tried diet at least 6 or 7 times.
Okay.
She has been exercising all her life. She has faced a lot of ridicule from some of her family and friends.
Okay.
And even colleagues, and she has almost come to a stage where she could not take it any further. She even, I think, considered to go in for bariatric surgery, and then she realized that because of the nodularity and the abnormal swelling in the hips, thighs and the arms, and the pain, the severe pain in obesity, surprisingly, the fat is not painful.
Okay.
In lipedema, almost 20 to 30% or more women have varying degrees of pain associated with lipedema. So these are all clinching factors leading to the diagnosis of lipedema.
What was your first instinct that made you realize that this is lipedema and not obesity?
Lipedema is a chronic connective tissue disorder where there is an abnormal deposition of fat in the arms, the forearms, the buttocks, thighs and legs. Whereas the midsection, that is the chest and the upper abdomen and the back, are generally quite slim.
Okay.
And even if it is associated with obesity, when they do diet and exercise, which most of the women try very seriously,
Correct.
with good intention, they lose the upper body, then the midsection, but they don't lose weight from the or size from the arms, the thighs, legs or the buttocks,
Okay.
the hips. So this is a very clear-cut indication that it is lipedema. Second is, some of them have also pain associated with thing on pressure. Some of them also have bruising and prominent spider veins, or they can start to develop varicose veins.